Hello everybody, Dr. Vince Gutierrez here, physical therapist. You can find me at movementthinker.org. It's been a while since I've done some of these videos, and it's time for me to jump back on and have some discussions. Just the state of the profession, you know? For those that don't know, I treat patients in Frankfort with a local hospital, Frankfort, Illinois, with a local hospital system, and I also treat patients in their home. So this week, I saw a patient who is coming from another location. She was being seen at a different company, and I'm seeing her now. And, I had to ask, why switch? What happened? Why switch? And it's a story that it's unfortunate that it's still happening, but obviously it's happening, and it's happening a lot because where she was at was seeing a lot of patients, okay? And this ties in perfectly to the questions that have been asked by Tony Maritato in our profession. What is a mill clinic? And I will give you my definition of a mill clinic. A mill clinic is a clinic that is clinic-centered, meaning they care more about the metrics of the clinic than the metrics of the patient. They care more about the metrics of the clinic than the metrics of the clinician, meaning the patient's outcome doesn't really matter. What matters is that the patient shows up, the patient gets billed 3 to 4 units, whether it's legal or moral is a whole different question, but the patient gets billed their units, the patient comes in 3 times a week, and the patient comes in forever, or until the benefits are exhausted, right? It's funny, there was a joke, and I became a physical therapist about 20 years ago, and this joke was out there. You know you had a successful outcome when you've exhausted the patient's insurance benefits. Seriously, we need to stop. Healthcare is expensive, life is expensive. We need to stop dragging out these patients' benefits unless the patient absolutely needs to be in therapy. So let's talk about what does that mean to absolutely need to be in therapy? The patient needs to be treated by the therapist. If the patient can be treated by an aide, which I'll get to this story in a second, if the patient can be treated by an aide, if the patient can be treated by a massage therapist, if the patient can be treated by a personal trainer, the patient doesn't need to be in physical therapy. So with this patient, I said, what happened? Talk to me about how the session went. I showed up and the person at the front desk told me to go get on the bike. I just start laughing. I can't help it. It's funny. I would never have my receptionist, I would never have my secretary go tell a patient what to do. That's not cool. That's not appropriate. My secretary should not be treating patients. Okay? When I treat patients on my own, and let's say that I have, my kid doing some of my social media or my kid, updating some of my videos, I would never have my kid treat a patient because my kid's not licensed and neither is the secretary. So at that point, I couldn't stop laughing right off the bat, And so the patient then goes into the clinic, jumps on the bike, which the patient could have done at the gym, and the patient did do at the gym because the patient has a bike available to them at a gym and the patient has a bike at home. So why is the patient coming into the clinic to do the bike and be charged for doing the bike? That's where things get a little, that's where I get passionate, because the patient should not be getting charged to do something that they've already done that day on their own independently. Whole nother story, whole nother topic. Maybe if I remember, I'll come back to it here. Next, I said, what did the therapist do? I don't know who the therapist was. Well, who treated you? A girl? A girl? Hi, my name is Dr. Vince Gutierrez. I'm going to be your physical therapist. When I walk out, I introduce myself to the patient. Hi, my name is... Anyways, hi, my name is, and I'll be your physical therapist today. All of my patients know I am a physical therapist. I'm not an aide. I'm not a physical therapist assistant. I'm not Joe Schmo off the street. I'm not a personal trainer. I'm your physical therapist. They know who I am. And if they care to ask, I'll tell them I have a doctorate degree. Not that it's a big deal, but if they care to ask, I'll let them know. If they care to ask, I'll let them know I'm board certified. To me, it's the introduction. What's my name? What's my title? Here you go. Let's go in back. Nice to meet you, and let's rock and roll and get this started. When the patient's telling me they don't know if the person was a therapist or not, man, it's shady. It is shady at least, because these patients, their insurance companies, are paying for a licensed therapist, especially if these patients are Medicare or Medicare equivalents, meaning some sort of Medicare Advantage plans. These patients are paying for a licensed physical therapist or licensed physical therapist assistant. If it is not a PT or PTA performing treatment on these patients should not be billed. Therapist, I'm speaking to you. You should not be billing the patients if you have the aide doing treatment. Patients, I'm speaking to you. If you're seeing this in the clinic, if you don't know who your therapist is and you think that you're being treated by an aide and you have Medicare and they're billing you, man, there's something called the Medicare Fraud Hotline you should call. Google it. It's easy to find. Next. Where was I going with? Oh, sorry, I got hot with that one. Patients are not widgets. Getting back to the mill definition. If the treatment is clinic-centered, it means that clinic is focused on profit over patient. I get it. Clinics have to try to make a profit. I understand. I owned a clinic for a long period of time. I still do my own side gig, 1099. I like to make money. Money is good. I work for money. Money feeds my family, right? But at what point is it unethical to make the money? At what point is it illegal to make the money? If you guys have even the slightest bit of interest, just Google DOJ. For those of you who don't know, that's Department of Justice. Google DOJ and physical therapy, and you will see how many different instances physical therapy clinics are paying back the government for treating patients and billing the treatment when they shouldn't have been. This is a very common occurrence in physical therapy, and it's unfortunate. But what's fortunate for you, and this is where I'm throwing it out there, is that if you report it, hey, you might have a little incentive to report this. So look into it. Look into DOJ physical therapy, and then also look at the Medicare Fraud Hotline if you think that this was you. You also have a stake in reducing fraud. We're hearing about fraud all over the place, right? In the news, on Facebook, social media. Fraud is all everywhere. Fraud is in healthcare, and we know it. Okay? I can honestly say, what I do now, I don't see it. Okay, I haven't seen fraud in a very long time personally. I hear about it all the time. I hear about it from patients. I just heard about it from a patient this week. I hear about it, but I haven't personally seen it because luckily for me, I've been able to land at very ethical companies. As a patient, you need to find those companies because not all companies are ethical. You need to know how you're being billed, and it's unfortunate. Not all companies bill ethically, not all companies bill legally. So you almost have to search out that ethical, legal therapist, and that's hard to find because not all therapists are gonna treat you as patient-centered care. They're gonna treat you as clinic-centered care, and you'll know it, right? It's one of those things where when you go to a therapist who's treating you one-on-one or who's treating you one-on-two but only billing you for half of the time. And it's telling you, hey, your insurance company doesn't cover this. You know, you could pay cash for this service, or we'll give it to you for free, right? Unlikely that that's happening, but it could happen, right? They could be, having you on a bike and you're on the bike for free, or, they could tell you, hey, you're at the point now where your insurance company no longer covers this. If you'd like to continue, you could pay a cash rate for that. That's very ethical. That's very legal. That's the way it's supposed to work. Not continuing to bill your insurance company for things that you could be doing at home on your own independently. Okay, next, patient-centered care. Typically, when you go to the doctor's office, physician's office, it's patient-centered, meaning the patient and the doctor are one-on-one, and they're having a discussion. The doctor is not trying to manage a circus and running between 4 different patients in one room. Okay, that's patient-centered care. I'm going to get pushback on this in my profession. I absolutely know I'm going to get pushback on this from my profession. I am not saying that a therapist cannot treat 4 patients at once. That's not what I'm saying. I'm not saying treating patients one-on-one is the only way to treat patients. But I'm saying if you're going to treat 4 patients over the course of an hour, you have to make sure you're billing that one patient only for the time that you're seeing the patient. Not for the time that patient is off doing their own thing. Not for the time that you tell the patient to go do 20 bridges and you come back 15 minutes later. That's not patient-centered care. That's clinic-centered care because I know you're billing for it. So if There's a tornado siren. Gotta go. Thanks for watching.